Although the consumption of alcohol occurs in moderation for most individuals, the misuse of alcohol can affect many people. In fact, in Canada, 4 to 5 million Canadians engage in high-risk drinking. Alcohol can cause short-term behavioral and physiological changes in the body. Some behavioral effects include sense of well-being, relaxation, and a euphoric state of mind. Some physiological effects include an abnormal heart rate and increased blood pressure. Long-term effects of alcohol can have serious negative outcomes on the body. These effects include digestive diseases such as cirrhosis and chronic pancreatitis, as well as cardiovascular diseases such as hypertension and strokes. Long-term effects of alcohol consumption can have a detrimental impact on diseases that are initially present within an individual and can lead to death. But are alcohol-related causes of death associated with similar occupational groups? Is heavy drinking associated with different occupations? Many studies have gone on to prove and explain that alcohol consumption is higher within certain occupational roles than others due to many different determinants. Many reports are consistent in that the highest level of alcohol-related mortality are among workers in the food and beverage industry, including bartenders, waiters and waitresses, as well as cooks. Following close behind are seamen, wholesale and retail trades, entertainment and recreation workers, truck drivers, and personal support workers. The real question is, why are these occupations more heavily associated with alcohol consumption and therefore alcohol-related deaths than others? A completed literature review proposed 8 factors that suggest explanations of why some occupations have high rates of alcohol consumption and related problems. These factors include availability of alcohol at work, social pressure to drink at work, separation from family or social relationships, freedom from supervision, very high or very low income levels, collusion by colleagues, stress, and recruitment of people who are predisposed to drink. These factors indicate that differing alcohol consumption levels across occupations can be a result of the different job duties and exposure that individuals face. Occupational roles also signify complex factors that reflect many determinants of an individual, including educational and income level, social status, and overall lifestyle. Now let's apply these risk factors. Bartenders, waitresses, and waiters have a high availability of alcohol at work. One may be directly encouraged to consume alcohol during work by offers of free drinks from customers. Additionally, people who already drink heavily may be more likely to gravitate towards a job where alcohol is served. Furthermore, employment in these environments may encourage a culture of drinking outside work hours. Men at sea may adopt a culture of freedom and are often separated from loved ones. Wholesale and retail trades do not require education above a high school diploma, and when compared to the higher educated, lower educated individuals are more likely to drink. Additionally, income levels in this area of work can often be of minimum wage. Entertainment and recreation workers often experience a culture of drinking and partying and/or social pressure to drink at work. They may also be separated from important relationships due to traveling that may be required. Truck drivers have freedom from supervision. They are typically always working on their own and thus have more chances to engage in drinking, and PSWs are subjected to large amounts of stress. It is important to note that other factors, regardless of job setting, such as biological and psychological influences, also have the impact to increase an individual's drinking levels, especially when paired with at least one out of the 8 factors mentioned prior. Examples include a biological genetic component in which increases one's risk of alcohol addiction, or poor mental health that results in depression or increased stress levels.
As outlined in the textbook, epidemiology is all about studying the distribution and determinants of health-related states or events in human populations. Now that we've gathered information about occupation and alcohol-related death, as aspiring epidemiologists, what can we do about it? The main population of concern when it comes to work-related alcohol abuse is among individuals struggling with moderate drinking problems. Many people with moderate drinking problems are able to hold down a job, unlike those with severe alcohol dependency. However, it is likely that they are unaware that they actually have an alcohol dependency problem because their independent social and workplace cultures support alcohol consumption as a regular behavior. This may explain why those struggling with moderate alcohol dependency do not receive necessary treatment. The team awareness training, as found by researchers, uses team building, stress management, and policy learning as avenues to reduce alcohol consumption. Team awareness training encourages workers to find alternative ways to bond with fellow employees that do not involve drinking alcohol. They found that the more employees were aware of alcohol policies in their respective workplace, as well as employee assistance programming available to them and alternatives to drinking, rates of alcohol misuse dropped significantly.
There are several ways an employer can ensure that his or her employees have lower rates of alcohol misuse in relation to the workplace. Some methods may include starting awareness of alcohol dependency from the very beginning of the recruitment and hiring process. Another way could be to include modules on substance use in training sessions. Or another option could be to plan staff outings that do not involve alcohol use. One of the most important things to note is that employees and employers need to be able to identify the signs and the symptoms of alcohol dependency within themselves and others. They also need to be aware of the resources available to them to address the problem without fear of discrimination or dismissal. As we learned, surprisingly enough, alcohol consumption rates differ amongst occupational groups, explained by the 8 risk factors mentioned prior, as well as individual biological and inherent characteristics. But what does this have to do with epidemiology? Understanding the determinants and distribution of alcohol-related mortality across occupational groups can result in public health assessment and surveillance, completing the clinical picture of alcohol-related diseases, as well as health promotion and education within the workplace, in hopes to decrease incident rates of alcohol-related diseases as well as death. This epidemiological information can also help us understand why certain occupations drink more heavily than others, and can lead us to awareness, prevention, and control that can allow for quality of life improvement as well as planning for the future.